Welcome, dear learners. Today we're going to learn how do we maintain safe environment in the working environment or in the facility. Remember, it is the responsibility of a nurse to make sure that he or herself also is safe whenever working in the facility. And also, it is your responsibility to make sure that your patient is safe. Therefore, we have to know how to maintain safe environment in the facility or in the working area. And so this is how we're going to do it. For today, we're going to learn how to perform social hand wash, and also we're going to learn how to perform donning and doffing of the gloves. And thereafter, we'll also learn how to use 3-bin system. Remember, the 3-bin system is meant to prevent biomedical hazards to end up leading to legal issues, because it will be your responsibility if forever you failed to maintain 3-bin system. It has medical legal hazards that are very adverse to a nurse. So we'll learn as we go. So let me explain to you what is happening here. This is hand wash facility. A hand wash facility should have a tap, and the tap should have a long neck such that you'll be able to wash your hands properly. And also the tap should have both cold and hot water. And you should have a soap, a liquid soap, for you to properly wash your hands. And it should have a guide that is being recommended by World Health Organization. So this is hand wash facility. So let's see. In this bin, which is a black bin, it is where we discard non-biological wastes. For example, things like paper, spit, and all stuff, we discard them here, only if they are not from the patient or while they were not in contact with anything that is biomedical. And also in here, this is where we discard biomedical wastes. It might be pads, it might be sanitary towels, it might be gauze, or it can be cotton, things like that. This is where we discard them, because we are saying that from the patient they have biomedical waste. So this is where we discard them. In this yellow bin, this is where we discard the sharps. So don't mix the three. Make sure that you discard accordingly, because if it can be found that you have discarded a needle, which is a sharp, in this red bin, you will be sued for that. Alright, for example, this is a needle and this syringe. When you discard, you don't unmount this needle and discard. Make sure that, because it's from the patient, both the needle and the syringe, you discard them all together in the sharp container. Okay? Fine. Now, since we're going to perform 3 procedures, the first one will be hand wash. But however, after performing hand wash, most of the time you have to wear the gloves. So you have to know how to wash hands and how to wear the gloves. So before you can wash your hands, you have to open the gloves and put them in a pack so that you can maintain what you call a sterility. So, for example, here I have my gloves. It is your responsibility to make sure that you know the size of the glove that you're going to use, because you know the size of your hand. For example, I wear size 8, so I don't know you, which size you wear. So this is how you open, and before you can open it, you have to make sure that it is not expired and it is still clean, it is intact, and it doesn't have any signs of swelling or being swelled. So this is how you open. There's a flap here. When you open the gloves, you don't just tear them out. You have to open it procedurally by performing it this way. You open. And then This is how you make sure that it will fall within your pack. Good. And you're done. You don't touch it inside the pack or any sterile area. So after that, this is the paper. So I have to discard it in it like this. Yes. Good. So after that, now I will show you how to perform social hand wash. So this is how you perform it. Make sure that you mix water properly by starting with the cold water. And then you open hot water. And then you mix. Make sure that the water feels lukewarm such that you cannot have burns nor have perform social hand wash with cold water. So it should be lukewarm. Alright, mine is lukewarm. And you can see the pressure that I've managed to regulate my tap. Make sure that the pressure is not high, not too slow. Make sure that the pressure is well regulated, because if you put high pressure, you're going to mess up your tap, your washing facility, and the water will be spilling out. So make sure that the water is well regulated. Good. Then, before you can even apply soap, make sure that you wearing your hands first. And it is your responsibility to make sure that your nails are short, because a nurse is not supposed to have long nails. Good. So my hands now are wearing. So now I can apply the soap. So this is how we apply soap. Okay. So you have to rub your hands and put the other hand above the other this way, and you have to use your palm, right? So you wash the palm first in a circular motion, and it should be fast, and you count 1, 2, 3, 4, 5, right? You'll be done washing the palms, and from there you have to wash between your fingers, right? By interlacing the fingers this way. So this is how you're going to interlace, and then you're going to count 5 times. 1, 2, 3, 4, 5. Okay. Now you'll be done washing your hands, your between fingers. Now you have to change. You have to wash your hands, the upper side of your hand, with your palm. You put another palm here, and then you move this way. This is how you're going to wash this part of your hand, by interlacing the fingers between the fingers. And then you have to also read or count 5 times. 1, 2, 3, 4, 5. Okay, and then you come to another side of the hand, and then you move between the fingers this way, interlacing them, and you're also going to count 5 times. 1, 2, 3, 4, 5. Okay, now you would have washed the upper part of your hand, and then now you have to wash the knuckles and the back of your fingers this way. So this is how you interlock your fingers. Put your fingers this way and then interlock them, and with the thumb move here and wash here. Rub it rapidly and count 5 times. 1, 2, 3, 4, 5. Okay, and then you change and come to another side, and you move this way. Also you wash the palms. 1, 2, 3, 4, 5. Okay, now you're not yet done, so you have to wash your finger, your thumb. So this is how you wash your thumb. 1, 2, 3, 4, 5, and you come to another thumb. 1, 2, 3, 4, 5. Okay, so we are almost done. Now you have to wash your nails. So this is how you're going to wash your nails. Make sure that they are not far apart from each other, and you move in a circular motion. 1, 2, 3, 4, 5. Okay, now you have washed the tips of your fingers and the nails, and you have to come to another side where you're going to wash another hand or fingers. So this is how you're going to wash them. 1, 2, 3, 4, 5. Okay, and from there now you have to rinse. So before you rinse, you have to wash the wrist and end here, and come to another hand and cleanse the wrist, and you'll be done. From there, now you're going to rinse. So this is how you rinse. You rinse from the tips of your fingers. Okay, so yeah, You don't just rinse anyhow. So you move your hand this way. It is recommended that you rinse up to the elbow because the water would have moved down your hand. So you also rinse the other fingertips. You see, now my hand, I make sure that the water trickles into the tap. It doesn't spill down on the floor. So I also rinse my hand, my other hand, and I move up to the elbow. Alright, so I have managed to properly wash my hands. Now I have to close the tap. Since now my hands are clean, I don't have to touch the tap with my hand. I have to close it with my elbow because it is considered to be far away from the head. So I start by closing the hot water and then cold water. Right? Now I have managed to properly wash my hands. I have to move on to how do we dry our hands, because also remember, we are maintaining safe environment. Our hands now are clean, therefore we don't have to contaminate our hands. So this is how we're going to dry our hands. A towel would have been folded this way. It has a fold in a pack where you're going to touch. You don't touch everything. So just fold this end of the folder and then you pull it up, and then now you come and dry your hands, starting with the small finger. You move with the towel, you move to the right finger, up to the thumb, and then you have to dry it up to the elbow in a circular motion. Don't go up and about, going up like this, because by doing so you would have taken the gems here and put them here. So you go down the elbow with a circular motion, then my elbow is now dry. I have to change my towel and come to the other side that I have never used. So I dry this hand starting from the small finger, and I move, and then I dry my hands down the elbow, in a circular motion. Right, now I hold my towel in the middle like this, and then I have to throw it below the trolley because I'm still going to use it after washing it and sterilizing it. So this is how you throw it. You don't just put your hands below the trolley because it is considered to be unsterile. So it's unclean. So we have to throw it like that. So ladies and gentlemen and friends, so now we have managed to thoroughly dry our hands, and our hands are clean. Remember, you are not supposed to just touch everything after washing your hands, because we are saying we don't want to contaminate your hands, and your hands should be maintained in this position such that your hands are not above the neck nor below the belt, because those areas are considered to be unclean and they will expose your hands to being contaminated. Okay? Alright, so now we're going to see how do we don the gloves, or how do we put in the gloves. So let's wear the gloves, right? This glove, this is the only area that you can touch after washing your hands. You don't just touch inside because you're saying your hands are clean. By doing so, you will be contaminating, because you're saying we have to make sure that we maintain sterility in all means. So we open it this way, okay? And then we open the fold. Right? Okay, so this is the right hand and this is the left hand. Make sure that you don't interchange your hands such that you put in the left hand in the right hand, because that happens later. Okay, and so this is how you put in the gloves. You don't touch the gloves anyhow because you don't want to contaminate them. The glove is folded such that the inside is folded outside, and your non-dominant hand is going to touch the inside part which is being folded outside. You don't touch the outside part because you will be contaminating. So I will have to start with my dominant hand, because it will be able to help me to wear the gloves on the non-dominant hand. So this is where you're going to touch with my non-dominant hand, which is the left hand now. I have to touch here and then put in my fingers such that I am targeting the fingers of the glove. Okay, so that surely. Okay, I can leave it here and I'll correct thereafter. Okay, now with my dominant hand, which is now having the glove on, I have to wear the glove on my non-dominant hand, which is the left hand. So I don't touch anyhow, because I'm saying the outside part is still clean and it is still sterile. Now I'm going to touch the outside part of the glove because it is folded. So I put in my 4 fingers this way, okay, and then push fingers in, and then I make sure that the opening is clear such that I can put in my hand, my non-dominant hand. I put it here and I can feel my fingers, and I make sure that at least I'm below the fingers, and then I pull it up this way. Okay, you see I'm still holding attaching my glove outside, not the inside part, and then I can leave it there. Now that the glove here, the gloved hand, non-dominant hand, which is the left hand, is now having the glove on. Now I have to correct the non-dominant hand, and I'm still holding the glove outside, not inside, such that I'm not contaminating. Okay, so we have managed to wear the gloves. Okay, after wearing the gloves, you have to discard this paper that was covering the gloves immediately. So this is how you touch it. You don't touch it outside. Remember, because this area is not contaminated and it is still considered to be sterile. You hold it inside this way. You don't have to fold it so many times. By holding it here and then just doing this, you are done. Now you can throw it in the leg in this way. Don't go inside. Don't put your hand inside the bit because it is very dirty. You throw it in there. Alright? Now, we are done for this step of wearing the gloves or donning the gloves. Alright. Now you have performed the procedure and your hands now would be dirty. The gloves would be maybe having blood or pus or anything. You are not from the patient and you have to discard the gloves. And the way you're going to discard the gloves can expose you to a risk of acquiring infections if you don't do it procedurally. Remember, we are learning this maintaining safe environment such that we are not going to experience having to experience some diseases that we may acquire at work, that is occupational diseases. Okay, so, and also if you contaminate your hands and don't wash your hands properly, you don't wear the gloves properly, you might also cause nosocomial infections by leading to exposing other patients to diseases that they will have acquired in the hospitals. So this is how you're going to remove the gloves. When you remove your gloves, you still start with your dominant hand. After removing the glove with the dominant hand, now you will move into the non-dominant hand. So this is how you're going to do it. Since now gloves are dirty, you will have to touch the dirty part of the glove using the gloved hand. So I'm starting here, I remove it this way. I still put in my 4 fingers. I pinch here and I pull in my 4 fingers this way. Alright? such that I can roll it out. I'm rolling my fingers, I'm rolling the glove down the fingers, and then I grip it with my palm and fingers, and I hold it inside. You see? Don't just put any pull anyhow, because if you pull badly, you will spill the blood or anything anyhow. So I'm done. I've removed the glove on the dominant hand. Now I have to move on to non-dominant hand. Also, I'm not going to touch the glove with my clean hand because I will be contaminating this poor hand. Now I have to put in the finger inside the glove. So this one is very big. I will put the 7th finger this way, okay? After putting it, I can now put my 3 or 4 fingers inside, such that I move the glove down and roll it outside. Okay, you see, now I did not contaminate my hands. I can discard these dirty gloves, soiled gloves, in the red bin. Now I've maintained the 3-bin system, okay? So this is how you're going to discard. And thereafter, remember, you don't just go and do another procedure or go to another patient without washing hands, because we still want to maintain safe environment and make sure that our hands are clean. Now you have to go and perform social hand wash again, which you have already learned. So thank you very much. So this was how we perform social hand wash and how we maintain 3-bin system and how to do and doff the gloves. I hope you have enjoyed it. Till we meet again.